Hello, everyone. Welcome back to Coach Chrysler's Combos. Today, I am joined by a new friend. So hello, Rebekah. How are you?
Hi, all. I'm good. How are you?
I am doing great. Thank you so much for joining me today. So, of course, I want to talk all about your health journey and how you've used functional medicine. But before we do that, tell everybody who is watching who you are, where you're from, and what you do.
Sure. So I'm Rebekah Zonosky. I am a mom to 4 kids. The oldest is 9, the youngest is 3. So it's a busy household over here. And I am a pediatric nurse practitioner by training. I was actually born and raised in Canada. And then I moved to Texas in 2004, and then we kind of bounced around a little bit, but we've settled back here in Texas and are growing our family here. And I have my own pediatric functional medicine practice.
Fantastic. Yeah, being a mom to 4 kids, 4 little ones, especially, definitely a busy season of life. So let's talk a little bit about how you came into functional medicine and kind of working in that space.
Sure. So ultimately, we had a pregnancy that ended with anencephaly of the baby. So, which, I mean, if you look at the research and things, it says it's like really a folic acid deficiency. That was our second pregnancy. I didn't really know any better, took the folic acid like we were supposed to for, in the prenatal vitamins for the first one and for the second one. But the second one, the cord just didn't zip like it was supposed to. And so I didn't really dig too deep, ended up getting pregnant again with our second child, our second daughter, and she was born healthy and everything was fine with her pregnancy, but it wasn't for me. Like I had a really tough pregnancy with her, lots of GI issues that were kind of, the OB was wonderful, but it was sort of like, here are the Band-Aids for dealing with these issues when you're pregnant. And so there's not really a lot that they can do. And then also I ended up getting like the autoimmune rash that you can get when you're pregnant,
Wow.
which was like a bit of a mess. All of these things that didn't happen with my first pregnancy, and it was following the second pregnancy that ended up in anencephaly. So long story short, she was born nice and healthy. And then we got pregnant with our first son. And I was like, I'm not doing that again. Going through all of those things.
Done with that.
I was like, that was not a fun pregnancy, like 9 months plus of like just not comfortable. And I didn't feel like I was healthy and wanted to provide the best. So I just started digging and started learning about gut health and started learning about kind of the MTHFR gene and epigenetics, all these different things. And so there's lots of different rabbit holes that you can go down, but ultimately I focused first on gut health because that's something that you can totally do when you're pregnant without like lots of risk. So just kind of changed my diet and took some probiotics, learned about prebiotics, magnesium, which was like a wonderful thing when I was pregnant.
Right. Yeah.
All of the things. And so that's really how I started. And then just from there, I kept learning more and more. Once our son was born, I stopped working in the hospital full time and then started focusing on functional medicine education. And so I've gone through the IFM program, and I've also done a nutritional program. And yeah, I felt like as a pediatric nurse practitioner, there's not enough functional medicine practitioners in general, but specifically for pediatrics, I really have a passion to try to get kids started off on the right foot, even if they're already struggling with really a chronic illness or a diagnosis that really there's lots of hope for, and try to set them up for a life full of vitality for a long time.
Yeah.
So, yeah.
Yeah, that's fantastic. That is what this YouTube series is all about. It's all about letting people know that they can still hope because there is help out there. There are things you can do in so many different ways. There's so many different paths you can take. So if you've tried 1, 2, 3, 4, 5 things, there's still other things that you can do. So I'm so glad that you said that, because that aligns perfectly with what we're trying to do. So wow, what a journey you have been on with dealing with these multiple pregnancies that were difficult for you, your babies, that type of thing. I have also been on a similar journey, although I did not find out about functional medicine and really come to understand what it was until well after my 2 boys were born. But man, I totally agree with you. I totally see what you're saying about, starting off on the right foot. And even when there are things maybe you didn't know in the past, but start today, right? There is something that you can do. So you mentioned gut health, and I want to talk a little bit about that in terms of your journey. So where did you start kind of with that?
So really it was initially probiotics, because they were kind of coming on the scene. If I think of it, like this was back in like 2016, really. So a lot of research was coming out then, and just kind of in mainstream. So I started digging a little bit deeper. And then also magnesium, just as a supportive thing to keep things moving, and just realizing how deficient most of us are. And trying to think, oh, well, that's a really easy thing. Why didn't anybody tell me that?
Right.
Like, my life would have been so much more enjoyable.
It's like, hello, essential minerals.
Hello.
That is something that we need for our body to function properly. It is a part of hundreds of functions in our body. So probiotics and magnesium, great start. So once you were regularly taking the probiotics and the magnesium, what changed for you? How did you start to feel?
Oh, better energy for sure. Don't get very sick. Didn't have any of the complications with my first son or my second son pregnancy. Everything was smooth. I was very comfortable. Weight gain was fine. Nausea was under control. I was able to go to the bathroom, which I know so many pregnant people struggle with. Yeah. But it's just, people just brush it off like that, your OBO, that's just part of being pregnant. I'm like, no, that doesn't make any sense. It's really not. It doesn't have to be. If I could just tell all these moms to be that you don't have to suffer. And then really from there, I always have eaten fairly healthy. I mean, I was a kid of the 80s, so you grow up with like understanding how things change, but adding more fiber to my diet, whether it's a smoothie and dumping some flaxseed in there, and just understanding like the importance of prebiotics on top of probiotics and that kind of stuff. I mean, there's so many different things and aspects, but I mean, all of it's, to me, the choices weren't that difficult to implement into our lifestyle, which I guess was the biggest thing for me at the time. And I was like, oh, wow. Like, again, why didn't anybody tell me?
Right. This is simple. Like, it's just 1 or 2 things you start with, let your body adjust and get back to functioning properly. And then you can take another step. It doesn't have to be this big, huge thing, all or nothing, right? Just one simple thing, and then add something else and build that into, as you said, your lifestyle. That's so important. So for those that are watching that don't understand the difference between prebiotics and probiotics, can you give just a quick breakdown of that?
Sure. So ultimately, probiotics are what we call the good bacteria or good bugs in your gut, right? You need them. Everybody has a gut microbiome. Most people have probably heard that term, but you need it to be balanced. The picture I use is like an aquarium with all these different colors and diversity and beautiful and healthy and vibrant. And all those colors are different bacterias. And so sometimes those get out of balance. So you add in probiotics to the good guys. And then a prebiotic is something that the good guys eat ultimately. So it's what they're producing when they eat that fiber, which is generally what a prebiotic is. You can get it in a variety of different foods, but that's their food. That's how they thrive. And that environment becomes vibrant and healthy. And the good guys stay in control ultimately.
So we want all the good guys.
Yeah.
And we want to feed the good guys so
Yeah.
they stick around and they help our bodies function the way they are. So probiotics, the good guys, the good gut bugs, we feed them what they need, the prebiotics, and then they help our gut microbiome to be nice and healthy and help the rest of our body function the way it's supposed to. And absolutely, we want to know about this just in daily life, but certainly in pregnancy and when we are preparing for pregnancy, when we are pregnant, and then of course afterwards, when we're trying to breastfeed and those types of things, because we want to pass those on to our children as well.
I mean, and that's one of the biggest things is when I see a kid in my office, it's okay. I ask about all those things about the mom, the mom, and then the birth, and then the breastfeeding, like all of these things come together to form your microbiome. And so it doesn't mean you can't fix it, but if some of those things are lacking or they didn't happen the way that we ideally would like them to, then yeah, things happen and show up even in childhood. So
yeah, absolutely. So I'm curious in terms of outcomes for your children, right? You mentioned your first pregnancy seemed to go pretty smoothly, and that was fine. But then, subsequent pregnancies, kind of looking at your children where you struggled and there were some difficulties there. Have you seen anything, or did you see anything with kind of when they were younger? Did they have any struggles that maybe your first child didn't present with?
Yeah, and the third and fourth one also, because at that point I was understanding. So our second child, Soraya, not the second pregnancy, it would ultimately be our third pregnancy, but she had more ear infections than anybody else did when she was less than a year old, which ultimately ends up in antibiotics. And then it's like we're chasing our tails trying to fix those things. I've breastfed all of them and none of them were C-sections. So they had all of that going for them, which is good. I do think, it's not just gut health, right? Like there's genetics play a role too. Right. And so I think magnesium for sure for my oldest son, he takes that. I think that's just something that I've, kind of passed on to him and how he detoxes and those things. I just recognize those things in him. So it's really interesting. I don't know. And maybe the younger two aren't quite old enough for me to like fully understand, but like see the big picture. But like I would say like infections and immune system are probably the two biggest things that I noticed from like up until this point.
Yeah, that's very interesting because with kids, they, especially once they start to engage with other children, go to daycare, go to school, they are exposed to different things and, they do come down with colds and whatnot. But I think maybe there is this brushing off of that. It's like, oh, well, they have a cold. Well, they have another cold. They have another cold. They have an ear infection. They have this. They have that. They have this. And it's like this constant, and it's like, well, they're just 5 years old and they're just going to be sick all the time. Well, no, that doesn't have to be. So immune function is so important, obviously, with that, and bolstering that, allowing for them to really take in the things that they need, and doing simple things like teaching them how to wash their hands properly, and letting them go outside and play and stuff and be in dirt. It's totally okay. I think that's really important, and I'm glad to hear you say that. So one of the things you mentioned when you were telling your story was the genetic mutation, I always forget the order, but it's
MTHFR. Yeah.
So was that something that you found that was applicable to you, or is that something you just learned about along the way?
I've never personally done the genetic testing, but I do, based on my family history and my history and understanding how all of that works, I could probably tell you my genetic testing would be positive for it, just because that's because I've just learned so much about it and understand. And
Right.
so I mean, I do think it's helpful for some people to have that for different reasons, maybe not necessarily just the folic acid piece or, making sure you have enough folate, but lots of different reasons. But yeah, I do. That's just the tip of the iceberg, really, and the genetic things. I mean, there's so many different little tiny, what they call SNPs, right? Like the single nucleotide peptides that are maybe just tweaked a little bit or get turned on or off by what you're exposed to in your environment. And that is so interesting to me. And I think we're just really getting to under the surface of understanding how those things impact us and our health overall.
Yeah, it seems like we are very heavily genetics focused, which certainly they play a part, but it is, I think, important for people to understand that your genetics really only play a small part, maybe a smaller part than what has been enforced or discussed up to this point. So, and even with that, as you said, there may be something major or minor there that still can be adjusted based on your food intake, based on supplementation, based on, how you are addressing other things like stress and sleep and, all those different things. So that's very, very interesting. So as you mentioned your nutrition and you eat fairly well and have pretty consistently. What would you say, kind of thinking back, to early on in early pregnancies, and thinking about now your position in dealing with children on a variety of levels, what would you say nutrition wise you would really encourage women who are wanting to get pregnant or maybe who are already pregnant? What would you encourage them to think about and research and try to kind of get for themselves?
I think the biggest thing, and it sounds probably cliche, but the idea of like eating all of the colors of the rainbow, like there's so much there in the pigment and the antioxidants and polyphenols and all those different things that you get from all the different variety of fresh fruits and vegetables. So I think, like, to me, that's fairly easy to do, right? Like just put a poster on your fridge and like look at like that has a rainbow color or whatever. I mean, if you do that, I think you bring awareness to yourself about how much you're not eating all of the colors, because I think a lot of people think they are, oh yeah, I eat my vegetables, or it tends to be the same vegetables, like over and over. And it's not really all the different varieties of all the colors. And each of those provides so much benefit for our health. So I think that's one of the biggest things to focus on, and making that like the biggest portion on your plate. Vegetables, not necessarily fruit, like, make veggies like, and I try to give that to my kids too. Like every meal, like here's all the different veggies. And I mean, we're in fall and the season is beautiful. And there's all these wonderful colors of like, squash and root vegetables and all that. Just put them on your plate. And there's millions of recipes out there on how to like make vegetables taste good, So everybody eats them, including my kids. Like we make what we call carrot fries. They're not fries, they're just carrots, but they taste delicious. My kids love them. And I make them, make them with a rainbow carrot. So you're getting all the different colors that you can get from carrots.
Yeah, you mentioned putting something up so you can see and you can actually visualize what you're getting and that type of thing. And so, and earlier you mentioned IFM, which is the Institute for Functional Medicine. They have some excellent tools, and it's actually a tool I've used with my kids. It's just a one-page sheet, and I'm a nerd, so I laminated it, and I put it on my refrigerator. And what was really cool was, it just got my kids thinking about what they were eating. And so we did a quick little challenge, it was like, okay, 1 week, let's see how many colors you can mark off. And there's little boxes so they can mark them off themselves. It's like, oh, I ate a red one. Oh, I ate an orange one. Oh, today I got purple and green. And so at the end of the week, we could see how many of their little boxes were marked off. And it was a great challenge. And honestly, as a mother, it challenged me because again, I thought, well, I feed my kids pretty well. We eat at home 6 days a week. I cook, or, I have something prepared, so we have leftovers or whatever, but 6 days a week we're eating at home. So I was like, certainly we're getting what we need. And that was like a little bit of a wake-up call, like, oh, we missed this entire category all week long. So what could I try, in the next week to see if I can get us in that category at least one day? So there are some excellent tools out there. There's some great resources available, like I said, IFM and a variety of different sources to get those things in. Yeah, that's fantastic. So in thinking about how you are, or even maybe how you were as a mom to your second born versus, the third and fourth, did you feel like there was a difference even in how you were able to parent them, with having more energy and, different things like that?
Yeah, I do think, well, first of all, you add more kids, like that's just, it's just like exponential, right? It's not like, oh, I just plussed one. It's like, it's the exponent changes. So everything gets more. And so I do think, sleeping, as I took care of my health more, managed my stress better, all those things, I was able to have more patience, even when they're challenging me, or be able to multitask in a different way. Multitasking isn't really a thing, you know what I mean? Like manage all the different windows that are open in my head of things I need to do. Cause that again, just multiplied, the more kids I had. So I think that's been a huge thing for me as managing my own health, to be able to be a good mom for them and to be there and have the energy to go play in the backyard, get them to their activities, come home, manage all the stuff at home, make sure I'm sleeping properly, or I stay healthy so I can take care of them if they're sick, that kind of thing. I don't even get phased really if they're sick. I'm like, oh, it's fine. I'm fine. Cause I just I really believe that I'm taking care of my immune system, and it doesn't mean I never get sick, but it's not it's not going to knock me out for 2 weeks. So
that is essential, because, once one gets sick, oftentimes at least one other gets sick, or, something like that. And so it's not that we don't ever, but how our body responds is definitely different when we are stronger, when our body is functioning, relatively well, and we have the tools and are using the proper tools. So you mentioned managing stress. Can we just address that really quickly? Because, as a mom, there's all the stressors, right? There are emails coming at you from school. There's schoolwork, there's grades, there's getting your kids to and from all the activities, there's feeding them, there's, bath time. There's all these different things that are going on day to day. And yet at the end of the day, you got to be able to go, I made it. We're good. Everybody's still here, So what are some things that you do to help mitigate those stressors, even just the day-to-day ones?
Yeah, for me, exercise has been a big thing. I know, or just movement. I don't know, like overwhelm people by saying exercise, like just moving my body in some capacity is a huge factor for my mental health. And I can tell if I haven't done it. So give my kids.
Yeah.
Just, it used to be like, oh, because I want to get stronger, oh, like lose weight or whatever, but it's not even like that's not that those aren't good benefits of exercise, but it's more for the mental health. Because as I've gotten older and the more kids I've had, I just realized that your body like holds everything there and it has to release it somehow. And so for me, exercise is one, or like listening to music and singing along in the car is another one, or just like removing myself if like tensions are high, removing myself from the situation for like 5 minutes, which is, it's really tricky. And no, I'm not perfect at it, and breathing, like, honestly, like it's so underrated, just remembering to breathe, because I think that's one of the first things for me, for sure. And I think a lot of people, you end up holding your breath, or you're not taking a deep breath when you don't even realize, like if I'm driving and I'm thinking about the 17 things that have to happen before the end of the day, I'm not breathing. Like I'm not taking like a big deep breath and relax. And so it's my mind is then taking control, telling me and getting worried, and I'm getting all worked up, and then I'm holding my breath. And it's like, you can like, I can almost like see it happening inside my body. Like my cortisol is going up, like here goes flight, fight, or freeze happening. And so I'm like, no, stop. Like I will tell myself stop. And just like, I will take like 5 deep breaths and like tell myself in my head, like everything will be fine. Like thinking about it's not changing anything. So,
right. Yeah. Those are all great tools and very active things, right? I mean, breathing doesn't seem like it's very active, but when you're stopping and being very mindful of it and recognizing how your body feels before and then how your body feels afterwards, you're activating something very important, and you're really being mindful and being intentional about that. So even taking just a couple of slow, deep breaths is very important. And pulling yourself away from the situation. I have been known to say, "Mommy needs 5 minutes," and I go in my closet and I shut the door and I just give myself a few minutes. And then I'm like, okay, we can move back forward through all of this. So so what's your favorite kind of exercise?
Kickboxing.
Oh wow. All right. You're really moving and getting that aggression out.
That's right.
Awesome. So with now, having this business and being in nursing, and also having children, and all the things that you do in your daily life, how do you feel like prioritizing your health has helped you maintain everything? Maybe not perfectly, because we certainly aren't perfect, but how do you think prioritizing that has really helped you be a mom, helped you in your business, and give attention to your patients and things like that?
I think, I don't know how to describe it really, but when I'm in my zone of like studying for some functional medicine exam, or learning or listening to a podcast, or going through the lectures, or like preparing for a patient, it reminds me like why all of those things are important. It's sort of like it gives me a big picture of like, that's like, this is why health is important. And this is like all of the things I'm going to be teaching somebody or educating them on or helping them through are like the reasons why I still prioritize my health. Am I making sense? And it keeps me in that mindset with myself and my family, like, and my kids, right? Because there'll be time, like, doesn't mean you don't go on vacation and have fun and like eat your cake or whatever, but it's just like, this is like, this is my lifestyle and this is why this is my lifestyle, because we're trying to go on the preventative side of getting to the point where I need to like pick up the phone and call somebody. Not that like illness isn't like ever going to happen. You know what I mean? It's just,
Right.
It keeps me in, the best thing I can say is that mindset of, and it almost is to the point where I'm like, oh, well, everybody already knows all this stuff, because that's the input that I give myself is I surround myself with things that keep telling me like, this is like, these are why these are the healthy choices and way to live and lifestyle decisions, you know? And so then and walking that talk is ultimately really important to me, because I can't go like tell somebody else how to live their life and be like, not being able to do it myself. Like,
Right.
especially as a mom, and especially as somebody who's trying to help people who have kids, like it's a family thing when you're dealing with your kid. It's not just like, oh, you can, you know, it's not so individual. It's really like, you gotta think about the whole family. And so having practical advice for people is also really important. So
yeah, modeling it for the people around you, whether that be people in your community, in your family, your friend group, your patients, being that model for them, yeah, certainly is encouraging for us to keep going, yeah, and doing the best that we can. So you mentioned going on vacation and having a little kid. So what happens when you do have those moments where you aren't behaving in a way that is aligned with your values? Or what happens when you choose to eat those extras, right? A little extra, when again, it doesn't really align with what you know is to be the best. How do you respond to that?
yeah, like, well, first my body like tells me like, you know, it just doesn't feel great. Like, it's like it's sort of like you get on the vicious cycle again of like, oh, well, I'm eating that to get more energy. And then now I'm craving this again because my energy's down. I didn't sleep good and I'm not exercising. Like, it's sort of like this, it's a very slippery slope in the sense of like, doesn't mean that you can still enjoy life, right? Like that's not, I don't mean it to say like, oh, you can't ever like enjoy it and you can't get back on track. And it's not even off track. I think it's just, I'm making a choice to enjoy those things. And I may not feel that great tomorrow. Like I already know I'm not like, or this is what's going to happen in my body. And I'm now going to have to manage the consequences.
Right.
With, I don't know, some extra magnesium, or like then taking a break from whatever it is that I ate for a week after, just so I can reset my system. And I think that's why, you know, it's such a personalized thing, because everybody responds differently and everybody kind of, you know, what works for one person doesn't necessarily work for the other person. So it's not like I'm over here judging myself. Like I know what I can handle and I know if I've crossed a line, but I also know like how to get back over the other side of the line. So I think that's ultimately what I want to tell people is like, you just have to figure out the tools that you need in your toolbox to like keep yourself on track as 90% of the time.
Yeah. So what I'm hearing is, one, do not expect perfection, because
no.
But two, listen to your body. We, you know, I think sometimes something will happen and we go, oh, well, it's not that big of a deal, or, oh, well, that's normal. And it's like, well, is it common or is it normal? Because those are two separate things. So listening to our body and then responding accordingly, responding in the best way that works for you as an individual. So, you know, some people, you know, their body responds with lower energy. Some of them, their body responds with waking them up in the middle of the night, and so they're not sleeping well. You know, whatever that looks like for you, take notice and respond accordingly. And then finally, give yourself some grace. You know, you're not going to do it 100% of the time. If somebody tells you they do it 100% of the time, I'm going to go out on a limb and say,
I would agree.
But, you know, just give yourself some grace and recognize that, you know, you can always make a change. You can always make a change. Just because you had an extra piece of cake, or just because you didn't get out for that run, or just because you had, a crazy mommy moment and lost it a little bit, doesn't mean that you can't dial it back.
Yeah.
Think about, what change needs to happen, and then move forward in that direction.
Yeah, 100%. Totally agree.
Yeah. Yeah. Well, this has been so fun talking with you. I'm so glad that we connected, and I so appreciate your time and hearing your story. If people want to hear more, if they want to know about your practice, or maybe if they want to just send you some questions, how can people get in touch with you?
Yeah, so my pediatric practice is called Childhood Upstream. So the website is just www.childhoodupstream.com, all one word. Email is the same, it's just at Gmail. So childhoodupstream@gmail.com. And then on Instagram, also the same, just at Childhood Upstream. And then I have Facebook page too. That's like more complicated, but you can just Google it. But yeah, it's all the things, ultimately Childhood Upstream, and that tells you kind of about my practice and what I do, and who I am. So
awesome. Well, you've made it simple with keeping the name pretty standard across the board. So that's fantastic.
Yeah.
Again, thank you so much for your time and sharing your story. I know it is going to encourage some mamas out there, and maybe even some healthcare professionals that are watching. So I so appreciate you. And guys, if you want to connect with Rebekah, check her out. Send her an email, follow her on social media. And for everybody who is wanting to join the convo, make sure you subscribe so you don't miss any of these great conversations. Until next time, I'll see ya. Bye.
Bye. Thank you.